Hi, my name is Lindsay Keating, and in this video today, I'm going to be performing my Suds Enema checkoff. So the first thing I'm going to note is that I've walked into my patient's room, I've performed my hand hygiene, I have introduced myself to the patient, and I have also explained the procedure. And I'm also going to mention that I have created privacy for my patient as well. So now I'm going to tell you what equipment I'll be using today. So I have my clean gloves on and my goggles. And today we're going to be using this waterproof bed protectant for my patient so it doesn't mess their bed up. And I also have the cast iron soap concentrate. And I also have my enema bag, and my enema bag is already filled up. I have already filled up my enema bag to 750 to 1,000 milliliters of warm water or normal saline for my adult enema. And while I did this, my tubing was already clamped and it is still clamped. Yes. So, and I'm also going to mention that my tubing is pre-lubricated, and I would add some more lubricant so I can make it more comfortable for my patient. So now that my enema bag is already pre-filled up to 750 to 1,000 milliliters of warm water or normal saline for my adult enema, I'm going to go ahead and put some cast iron soap into my enema bag. So I'm going to take my cast iron soap, and I'm going to place some soap into my enema bag. Okay, so now that I have placed my cast iron soap into my enema bag, I'm going to gently agitate the bag that has warm water and normal saline in it with the cast iron soap, just so it all mixes together. And now that I have gently agitated my bag, I'm going to go ahead and prime my tubing. So I'm going to take my tubing and I'm going to unclamp it, and I'm going to do this near the trash can so it doesn't get all over my patient or the bed, and I'm going to go ahead and pry my tubing. So my tubing is primed now. So normally I would place this I would go ahead and lubricate the top of my tubing a little bit more. Although it is pre-lubricated, it would make it more comfortable for my patient to lubricate it more. So now I would normally place this on an IV pole or a firm surface. So today I'm going to place it onto a firm surface. So now that I have prepared my enema bag and primed my tubing, I'm going to prep my patient. So the first thing I would do is I would raise my bed to comfortable working height, lower the side rails, and I would place my patient in a left lateral Sims position. Next thing I would do is I would take my waterproof bed protectant and place it under my patient's hips, who is already in a left lateral Sims position. And then at this time, I would also tell my patient that through this procedure, I would want them to take slow and deep breaths, and I would want to have a bedpan nearby at all times. So now I'm going to proceed to starting my Suds enema administration. So I would take my tubing that is clamped, and I would, with my non-dominant hand, I would expose my patient's buttocks, and then I would insert the tubing 2 to 4 inches into my patient's rectum, and I'm going to stabilize it with my non-dominant hand. And while keeping it at 2 to 4 inches into my patient's rectum, I'm going to go ahead and grab my enema bag. So I have grabbed my enema bag, and I'm going to prepare the patient that I will be starting the Suds enema. And if they had hemorrhoids, I would just tell them to bear down. So I'll unclamp my tubing and proceed to the Suds enema. Now, if my patient was having any pain or discomfort, I would lower my enema bag. But normally I would have it 12 to 18 inches above my patient's rectum. But if they were having any pain or discomfort, I would lower my bag or clamp my tubing. And after my enema bag has run out of warm water and normal saline mixed with cast iron soap, I would gently take the tubing out of my patient's rectum, dispose of all of my supplies. I'd perform hand hygiene. Actually, I wouldn't perform hand hygiene yet. I would actually make my patient comfortable, dispose of supplies, perform hand hygiene, make my patient comfortable, lower the bed and raise the side rails, and I would also make sure that my patient is comfortable. So that should complete my Soap Sud Enema checkoff.